So we're going to talk about client education today. Client education, client communication. I like this. I always like comics. Doggy says, I love the chicken stuffed in the cheese, tucked in the steak bits inside the hamburger. And so he gets all that, and he still spits out the pill. And he says, I don't know how we're going to get him to swallow the pill. He says, try a layer of bacon. Well, I put this up because this is one thing you will be teaching your clients. This is an example of all the things you will be teaching your client all the time, and one is pilling your animals. So you will learn all kind of techniques and tricks, and but there's always this animal that can get a pill out of anything. And somebody brought up trifexis yesterday because for some reason I have a dog that will eat anything. Mulder, you met Mulder coming in here drunk last week. He will eat anything without question. He'll take your finger with it if you let him, but he will spit out a trifexis. That's interesting. So I had to do this with him. So that's just an example, one example of client communication. I have another thing about client communication. This is from the far side. Man talking to dog. He's saying, I've had it, you stay out of the garbage, Ginger. And what the dog is hearing is blah, 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 Ginger, blah, blah, blah. So that's the dog, but that's also sometimes what your clients hear is blah, 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 blah. You need to give heartworm medication every month. And they hear blah, 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 blah. That costs a lot of money. So we're going to talk about some ways to get around that. And you know, clients want to do the right thing for their animals, but a lot of times there are financial concerns. I know if you live in an area where there's a hard freeze, you can get away with not giving heartworm preventative, maybe for 1 month. I think that's legitimate. I came from Georgia, and people would always try to rock it 3 months because it was cold in Georgia in the winter, but it wasn't a hard freeze. So anyway. That was one thing. So what is client education? It's anything that we can inform the client about that they don't already know. So anything, how to pill a dog, heartworm, diabetes, and I put in there a little caveat, even if they think they do. Because a lot of times, especially with Dr. Google, clients think they know stuff. And they may know some. You know, they may have looked at things that were legitimate, but sometimes they have the wrong information if they have information. So we need to make sure that we are on top of that. Primary goal of the entire staff. So that was one thing. Everybody, of course, is going to be the veterinarian, the receptionist is going to be helping them with heartworm. Everybody's going to be helping, but it typically falls on us as the technician or assistant. We're the ones that spend most of the time with the clients, and that's usually our responsibility to educate the clients. So it can be anything. So I put models, like when I'm teaching a client how to clean ears, I always use a model because dogs have these funny ear canals that are shaped like an L, and clients will be cleaning way up here because they think, just like they don't want to touch their eardrum, the dog's eardrum, like we would if we stuck a long Q-tip in our ear. So I use models to show them how far away the eardrum is from the ear canal so that they'll get really good at cleaning deep in that ear. So a model, that's doing client education. Handouts, websites, verbal, in person or over the phone. So I've got a lot of examples of this, but any of that, just you talking, is client education. So again, I always like to tie everything back to our code of ethics. So not only is client education important because the client wants and respects it, but the veterinary professional's ethical and moral responsibility to prevent disease and suffering to promote animal health. So that's number 2 in our code of ethics. So if we're not educating our client to use the medication properly, to take care of their animal properly, then we're not following our code of ethics. So I like to tie it back to that. One of the things that's a good starting point for client education is to make a puppy kitten or puppy kitten kits. A lot of hospitals already have them. They usually can stand to be revamped. Some hospitals don't have them. It's a great way to go in and say, can I make a puppy kitten kit? Because this is your first opportunity when somebody comes in with a new animal And it may be their first time. I've been surprised, as many people have animals. A lot of times it's their first time having a puppy. I, for instance, have only owned one puppy in my whole life. I always end up adopting old dogs, so that's a lot of times the case. People haven't had a puppy since they were a kid. They haven't had a puppy in a long time. Their animal's 13 years old, so it's been 13 years since they've had a puppy, or kitten. So a lot of times they appreciate this information, and it's your first opportunity to really get some messages out there. So this were some things that I put in a puppy kitten kit that I've made up on the hospital's letterhead. Mission statement, those are kind of going out of style. I heard in my Western Veterinary Conference last year and some of the professionalism seminars I went to that mission statements are sort of out of style, so I don't know about that one. Because I think they can maybe be cheesy, but but definitely your services that you offer. So if you have emergency services, that should be in these. Keep in mind, this is going to a new client or potentially new client, so you want to have some information for them, a little bit about your staff. And this, of course, a lot of times is online now, but I still like the handing them the kit. Your vaccine protocol, if they're puppies and kids, what your expectation is, because that varies. And a lot of clients get confused about that, when and why they need the vaccines in a certain space of time. And then I like to throw in some swag, magnets, pens, leashes with the hospital's name on it, things like that. So they've got that handy. Magnets especially, refrigerator magnets, good thing. Okay, some other things that should be in your puppy kitten kit, and you can use, a nice little folder, so hold it all together. Zoonosis, number one, has to have something in there about zoonosis. That is the one thing, let me see where my thing is, that clients, you're really kind of legally required to share with clients. I like to tell people, of course we don't want people's kids to get zoonotic diseases, but that is the one thing that clinics will be sued for, and they will lose the case. Now you can, accidentally, hopefully accidentally, an animal will expire on your watch, but animals are still considered possessions in the States right now, the U.S. And so it's really hard to sue veterinarians if an animal passes away, except for maybe the cost of the animal. But one thing you will get sued for, and you don't want it to happen anyway, I hate to put it in lawyerese, is zoonotic diseases. So if somebody's children get zoonotic diseases and you didn't tell them about it and you didn't document that you told them about it, that could be really serious. So I always put a nice, and the gorier the better. I like the gory stuff. Pictures, like yucky pictures. The gorier the better. People need to be aware of what parasites are zoonotic and how to prevent them. So always put that in there. Ooh. Okay, so dog and cat vaccine guide, recommended trainer. I found it's always good to find out, do some research if you need to, and when people come in with young dogs or any animal, you should be able to refer them to some training resources, because that is a big thing. People have a lot of trouble with that. It's not something people know intuitively. I can teach someone how to house train a dog, potty train, but otherwise I need to refer them. This is just something, a book I had that it's called What All Good Dogs Should Know, The Sensible Way to Train. It's a little thin book, so I would encourage people to go get that. That's just a really basic little book, but it's great, simple, cheap. So I just always have these things in my head. People will ask you stuff, you need to have answers. So, and they will ask you about behavior. So when I actually don't know anyone here, but when I worked in general practice in Atlanta, I knew several trainers that I had done research on, and I approved of their methods, and it meshed with our clients' culture. So you should know that. You can't just say when a client comes in and says, you know, what do I do about behavior? What do I do about this aggressive behavior? You can't just say, I don't know. You have to have somewhere to refer them if you haven't. And it's a really good, it's a kind of up and coming, the behavior studies and getting more in tune with behavior. So commercial care and health guides, a lot of places have those still. A lot of things, vendors and manufacturers will come out with little things like this is one. This one's from the American Hospital Association, Lifelong Care. These little things that just have some really good information, basic information for clients. I like to put those in there. Then toxins, I usually put a thing on toxins in there. A lot, just kind of the general toxins that are, there's, I don't think I know where that is. There's vaccine guides. A lot of people have these little vaccine guides. People are really, you know, especially with all the human vaccine controversy, people are really doing research on vaccines, so you need to have your information on why we do it. And that's changing in the industry too. So handouts, like I have usually some little handouts about anesthesia. A lot of people are really scared of anesthesia, and they're going, if they've got a puppy kitten, hopefully they're going under anesthesia, because hopefully they're going to get spayed and neutered, and they're going to start dental work eventually. So stuff about dental, I like to get right on the dental cleaning, and that's something people will neglect till it's serious. So I like to teach them how to brush their animals' teeth, and a little bit about the need to do preventive, prophylactic dental care for their animals. And blood work, I also, I had a handout that a real lay explanation of blood chemistry, so people would understand when they do get blood work what it means. And then freebies, always good to have freebies in there. Like I said, some swag, and then, you know, they have all kind of stuff, kitchen magnets, but also your vendor should be able to give you some free heartworm and flea prevention. So little magnets, so all the freebie stuff is good. So all that stuff is really helpful. It really makes a bond and really helps your client have some information right in front of them. What do I do with my thing? Okay, so here's some resources. This is the other thing. A lot of, again, a lot of clients will go to the internet and start looking for information, and that's not necessarily a bad thing. I go to the internet all the time. There's really good stuff there. I think it's awesome. But there's a lot of, you know, questionable stuff. Everything's up there. So we don't want to just let people roam through the internet. The Wild West, one person called it. The Wild West of the internet. I thought that was funny. So these are some resources you can, available to you and to the clients. AVMA.org is /public. That's the American Veterinary Medical Association. They have a public website, and if clients go to that, you can recommend that. It has a whole list of more links where they can talk about veterinarians, pet care, emergency care, and it's all aimed at the layperson. So it's a good general website. So that's one recommendation. Veterinarypartner.com. So this is part of the VSPN. VIN is the Veterinarian Information Network, and that's for veterinarians. You can only go on there if you're a veterinarian. And the reason that is because veterinarians on that share information, you know, about cases and things. So it's, you know, it's private and it's for veterinarians to share case studies, basically. So when you're a veterinarian and you've got some thing happening in the clinic that you haven't dealt with, you go on VIN. Veterinarians do it all the time, and they look up, you know, dog with retained teeth or whatever if they'd never seen that, and they can see what other vets have done, and it's a really good resource for them. VSPN, Veterinary Support Personnel Network, is ours. That's been put together, and that's one. Who got on there? Okay, so you're on there, yeah. So everybody get on there. It has lots of continuing education, handouts for your clients. Just they have a weekly chat session. People just all kind of stuff that happens during the week. Veterinary technicians get on there and chat about it. So it's a great learning resource for you, and then it has resources for your clients. It's not available to the public. You have to be a veterinary technician, a practice manager, or a student to get on there. But that being said, they do have a third branch called veterinarypartner.com, and that's for your client. So you're welcome to recommend that and explore it yourself. So it's a great, if they have a, or having just freaking out about having a diabetic pet now, that would have some information for them about how diabetes works in animals, for instance. Another resource I use a lot is Hills. All the, I think, higher-end veterinary specific food and food manufacturers are good, and they have a lot of information. I just happen to always go to Hills because that's the one I learned first, and that's the one I've used the most. But Royal Canin has a lot of information and good products. But Hills has a great website for you called hillsvet.com, and they have like a nutrition course you can take on there. It's like a long course, and you can take it. I'm only on module 3. I haven't done it in a while, and it's detailed down to the scientific detail all the way. And of course they focus on their foods eventually, but their foods are, similar to other foods. But basically it's a really good nutrition course, and you can get a little certificate that says you took it. And then they have all other kind of resources about health issues that can be dealt with with nutrition. Again, nutrition is like behavior. It's really, and people are interested in it. People are much more aware of that now with their animals and much more interested, so you need to be informed. So that's a good way to get informed. And then Hills Pet is for the client. So that's if your vet has diagnosed chronic kidney failure and prescribed KD diet for a cat, and you don't have time to spend a lot of time talking to the client about it, then you can send them to hillspet.com, and it has a wonderful explanation of kidney disease for the layperson and what the kidney diet does. So, you want to, if you don't have time, and sometimes you're not going to talk as much as you should with a client, you need to be ready to steer them somewhere. I put also this one up, veterinarywisdomprofessionals.com. This is a website, organization that makes the clay paws. That's when you're going to euthanize an animal and you make a paw imprint of it. People love those. I've only had them declined a few times in all my unfortunate huge amount of euthanasias I've done with vets. And but they also, besides making those clay paws, which are really cool, they have a lot of information about grieving, things you can give to clients. And you would be surprised. Some people really haven't gone through this before. Amazingly, I had a client, an older couple, and older than me even, and I euthanized their dog after taking care of it. I did in-home care for a long time. And I didn't realize they had never had a dog before, and they'd never done a euthanasia, been through a euthanasia. And it was really, they needed a lot of hand-holding and a lot of information. And so that's a good source. They have some nice things. Avamark, which we'll be playing around with next week. That has a lot of information on it. I think the version we have doesn't have as many links, but your clinic can have links to all kind of handouts, client handouts, and things you can give. And as soon as your doctor makes a diagnosis, you can search and it will take you to links for information. So, and probably all the other softwares have that. I know Avamark does. And then your vendors, if you within your clinic, if you want to educate yourself or your staff members, you can ask vendors to do talks and information, or you can also go to them to get the brochures, freebies, things like that. So it's a good source. Any vendors, Megacore's the big one in Hawaii, and okay. So those are the AVMA ones. One more I wanted to tell you about. I could just go all day on these resources. I have a huge resource library. Now I have the internet. So Ohio State University came up with this thing called the Indoor Pet Initiative about 10 years ago now, but so many people were having trouble with particularly indoor cats. You know, the trend got to be that you shouldn't let your cat out at all. It should be indoor only for a lot of reasons, and that's not a natural environment for a cat, right? So they were coming up with all kind of problems, weight control, diabetes related to the weight, behavioral problems, because it's not a natural environment for a cat to be in, inside all the time. So they came up with some studies and some recommendations. So it's a great resource. They have it for indoor dogs too, dogs that are kept in most of the time. So it's called the Indoor Pet Initiative. So you can just send, you can go there or you can send your clients there. Great information for indoor animals. So another one of my favorites. Then there's a lot more. So people that can do webinars for you, lunch and learns, brochures, just a few more. Royal Canin is, you know, the like Hills has a lot of prescription dog products, food products, and they can do Marielle I like because they're super supportive of the vet tech profession. They were sort of, I told class yesterday, when the first vet tech convention I went to was about 12, 13 years ago now, was the North American Veterinary Conference in Orlando, Florida. And I was still in vet tech school. And I went around to all the vendors, and they all thought I was a vet because I was older, so they figured I was a vet. And so they would be talking to me, and then I would say, no, I'm a vet tech, and they would like quit talking to me. They would like, you know, move on, because they figured they just wanted to talk to the vets because the vets were ones that had the money. The vets were the ones that were going to make the decisions about purchasing food or new gizmos and gadgets for the clinic. That has all changed. When I go to Western, like last year, and I go around to vendors, they want to talk to the vet techs because they figured it out. They figured out that we're the ones talking to the clients, educating the clients, selling their products, and they love talking to us now. Come on in. So, which makes sense. You know, of course we'll talk to vets and stuff, but they figured out we're the ones that do the education. But Marielle was ahead of the game. They've been on to the vet tech. They have supported a lot of vet tech schools, and they always do at the conferences. They always do a big thing for vet techs. Pet Poison Helpline, really, they do a lot of really good continuing education related to poison and toxins. So lots of resources. So here's some opportunities for when you're going to educate your client, and of course there could be endless, but here's just a few. The new puppy and kitten, it's an ideal time, right? You get all sorts of stuff you can talk to them about and how to take good care of their animals. Fleas, people love to, you know, they need to know about flea life cycle because people do not understand the flea life cycle. Who's doing the fleas? Anybody doing fleas in this class? Okay, good. That's a good one. That's you need to have your spiel down because people need to understand how fleas work because otherwise they'll never get a handle on it. So regular and prescription diets, again, nutrition is really big. So, and also you should be informed about, you know, all the novelty boutique diets. You know, a lot of people will ask you about that, the raw diets and all that. And you should have, you know, again, and I have a caveat at the end, that this should all be what your clinic culture is approved of too, you know. We'll talk about that in a minute. Disease explanation. A big one is diabetes or kidney disease. You need to understand how that disease works. And you'll, you know, learn that in this program, but you need to have a good handle to be able to explain to people how disease processes work. Often the vet will do that, but often they will look to you for a clarification or a simplification or to spend more time with them. So again, it falls on us a lot of times. Vaccines, you need to understand your clinic's vaccine protocol and why. Again, they're going to want an explanation from you. Seasonal issues, again, like fleas and skin and all that, you need to understand where you live, how that affects things with the animals. Raising orphans, a lot of people will come to you with orphaned animals. And so if you aren't comfortable doing that, if you want to learn a little bit about it, I did a lot of orphaned animals, me and another tech, because I like doing it. It's very labor intensive. So you may not want to do it, but you should have a resource. You should have somebody, you should know how to get them started, and you can get, you can do some research yourself, you can get your veterinarians to help you, but expect orphan animals to be coming your way. Behavior, again, I already mentioned that. You're going to get questions about behavior. You need to have some answers. Pre and post-surgical, a lot of questions there. When the animal's going under anesthesia, you need to be able to explain about anesthesia and what the process is. Neutering in Spain, I hope everybody's a proponent and is ready to give the talk about why we need to do that. I have ironically, I have a friend back home who I took care of her dog for years. He had anatomically incorrect anal glands, so they would not self-express and they would get huge. So I did in-home care, so I would go about every 3 weeks and express his anal glands for him. Sweetest dog, Winston. So he passed away after I moved here, but she got a new dog, and can't think of his name now. And I met him, and he's really aggressive. And he's sweet, but he's got, sort of like Mulder, he's got a little aggressive tendency toward people. Mulder just has it toward dogs. But she will not neuter him. And, I'm a big believer in neutering and spaying. And she read something on the internet, and nothing I can do will convince her to neuter that dog. So I lost that one. So breeds, you already are learning about breeds, right? In one of your classes? Or you're not yet, but you will. Okay. You really need to be ready for that one. People will come in with breeds, purebred animals, or they'll be asking you to recommend a breed, and you need to be prepared for that. You don't want an elderly couple going out and buying a Jack Russell Terrier because they're cute. You need to be able to tell people about predispositions of animals, So because people will ask you, so you need to be prepared. Wellness programs, again, the need for prophylactic care and dental care, and then big one, weight management. You'll get that one a lot. So who's doing weight management? Who's doing, yay, cat or dog? Cat. That's a good one, because you see the dog ones, but the cats are more tricky. So yeah, so we'll be prepared. And okay, so those are just, of course, that is the diabetes, the cat with the diabetes. That's a big one. And so there's a lot of information that's critical with that, because that can be a life or death situation if clients aren't prepared to manage diabetes properly. And it's difficult, but it's doable. And we need to be able to help clients through that, because there's a lot of diabetic animals. Okay, so I just had one more website, and I just put it up because I came across it this week. I was looking up, for my dental class, I was looking up dental charting. And I watched a video last week about dental radiology and charting teeth to pathology on teeth. And this was a recommended website I went to, and I noticed when I went to it that it had information for animal owners. So this is really a website for veterinarians and veterinary technicians, but it has a link, a tab for animal owners. So I went to that, and it has all this: anesthesia, periodontal disease, pain and dental disease in dogs and cats. It's a big one. People don't understand how painful it is. And this is all aimed at the client. So just example, I've never been to this website before, and here's a whole wealth of information for me to share with clients. So, okay. So let's tie this into our week before last. So what about our Myers-Briggs and our other personality talks? So that's why we do that, because I want y'all to be able to communicate with your clients. And again, how these tests help us, these indicators help us, is by improving our communication. That's all what it's all about. So again, identifying your own preferred style. So if you're a really quiet person and you don't like to talk a lot, and you've got a client that really wants a lot of information, you've picked up on that they're asking questions, they're enthusiastic about learning about the kidney disease, they want all the information because they're that type, you're going to have to change your style, right? And so that's what this is about. That's, you pick up on those cues. And so, like, I put up the, again, the diabetes, that's a go-to one because you can give them all sorts of details, and some people will want that and need it. So that's where that plays into. In your reading, there's something called the 4 stages of client communication. Did y'all read that when you read the wealth of MyersBriggs information? So they recommend that there's really 4 stages. The initiating the interaction, that's when you're going into the exam room and you're saying, I'm going to give you a little information. I know you've got fleas and you're having trouble dealing with fleas. Let's talk. And so you're going to pick up right then what, kind of their vibe. Do they want a lot of information? Do they want the details? What style do they want? Do they want you talking to them calmly? Do they want you, making a lot of action about it? So investigating needs and suggesting actions. So that's sort of the meat of you communicating and educating your clients. And so if you go to the MyersBriggs, and again, this is just, sort of stuff you pick up on. It's not definitive. You're not in there trying to analyze your clients. You're just trying to pick up on some cues. And I just thought this was interesting. Does anybody remember what the S is? Sensing, right. And what's the opposite? The dichotomy of S is N, which is intuitive, right. Sensitive, intuitive. And then how about the T and the F? Thinking versus feeling. So again, the sensing, thinking person just wants the facts. Just the facts, ma'am. Nothing else. The sensing, feeling person wants the facts, but they want it kind of jazzed up a little. The intuitive feeling person, they want very personable approach, talk story about your animal, and they're also willing to do non-traditional. They might be interested in talking about acupuncture or things like that. The intuitive thinking person is going to be more logical, less personable, but they're interested in cutting edge, so they're going to be more. So just kind of a overview of kind of, and then the 4th step is your closing, just wrapping it up and making sure they have something to take home with them. You should always have handouts or have them write down a website, at the very least. I just thought this was interesting. When clients are given bad news, like terminal illness, possible need for euthanasia, this is kind of how it breaks down. They did some studies. Sensing, thinking people, they don't want you to ask how they feel. And about 30% of the population is sensing, thinking people. Sensing, feeling, they don't want you to be blunt. You need to sugarcoat it. You need to, really talk about it with them, hug them, even if you're not a hugger. At least touch. A lot of people, you're going to have to touch them. And actually, interestingly, 43% of the population falls into that category. Intuitive feeling, they want time to talk, and there's 17% of the population. And then the truth, intuitive thinking people, they want the truth and they want the big picture. They don't want details. They just want straight up, but big picture. 10% of the population. It's just kind of interesting. So if you wanted to hedge your bets, you'd assume they were sensing, feeling people, right? So that brings me to talking about end of life, quality of life care, hospice, and euthanasia. Those are big, big issues in our business, our profession. You're gonna come across it all the time. So this is another great website, Pospice. Instead of hospice, it's Pospice. And that's a good website, and they're really promoting, you know, a lot of cancer in animals, just like in humans, so they're promoting more pain, lost the word, care instead of, you know, invasive procedures. So, and also, again, hospice, just relieving palliative care. That's the word I was looking for. So that is becoming more and more popular for people. They're more and more interested, instead of going full out medically or euthanizing, they're interested in something in between. And more people are asking for that, and you will see that. Given that, there is a website, on that website should have it, Alice Villalobos is a veterinarian that has been onto this hospice and quality of life care for, she's sort of the innovator, the first one. And she came out with this scoring, way to score quality of life. And that seems like kind of counterintuitive, like you can actually put a number on something like quality of life, something objective on something so subjective. But it actually has been very, very helpful to clients for me. A lot of clients really don't understand what they're looking at with their animal. They know it's old, they know that maybe it's suffering, and they don't really know how to judge the big picture. What is the quality of my pet's life? And this has been really helpful. People don't think about hydration, for instance. People don't think about that their animal's dehydrated. And being dehydrated is very, very uncomfortable. It's like having the worst hangover ever. You know, it's terrible for animals, and you can show clients how to discern that, how to rate that. Mobility, and you know, it helps people to put kind of a number on it. Is this how, you know, comparatively? The big one that I have helped people so much is the last one, more good days than bad. I've had so many people be so grateful I've given them this, to have them think about it in terms of rating it. And more good days than bad is quality of life. If it's flipped, then they're starting to lose their quality of life. And the clients know what that is. And animals toward the end, or animals in pain with cancer, will have that. They'll have a really bad day, and the owner's so distressed because the animal's in pain and is having a really bad day, but then they'll have 3 good days. So if they're still having a lot of good days, still eating and wagging their tail, although I've had animals that will eat right up to the bitter end, but this helps people, and I've used it a lot, and it really helps, and it's available all over the internet. That Pospice has it. So I think it's a super good tool for your clients. So that's all. I just wanted to reiterate that all this information that you disseminate, you should have your permission from your practice owner, your practice manager. You should be on the same page. So if you should check with your vet, say, I really like to give them diabetes talk, or you know, you notice that they don't have kitten puppy kits. Can I make one, and can I put this in it? What's our vaccine protocol? Are we rethinking that? Are we going to 3-year vaccines instead of 1-year vaccines? So you need to be in tune with your client's culture, and if you know, or influence it. If you have some really strong feelings about things, and you, from what you've learned, you can do that. You can influence your client clinic culture, and then the clients, to take the best care of the animals possible, and keep a reference library. So you should, you know, I'm putting this PowerPoint up on Lalima, so you should print that out, at least those list of websites. You should really have that available to you. You will use it over and over again for your own education and for the education of clients. That's Mulder. Remember, the drunk dog. Okay, that's all I had. Any questions or comments?